Thank you for watching my video briefing. This project is something that I'm working on for my organization at the current time, and I'd like to share it with you. I am going to show you my PowerPoint because there are some statistics that will go into the decision-making process. Currently, Ozarks Community Hospital is thinking about purchasing 2 clinics, one in Branson and one in Forsyth. In order to complete the paperwork on time, we would need to submit it in June of this year, so we didn't have a delay in payment. That's just part of when you're purchasing a rural health clinic. The change of ownership paperwork can take some time. There are some key factors that I usually take into consideration when we're thinking about a big transition like this, and I'd like to share some of those with you. First of all, when you convert to a rural health clinic, you potentially could see an increase in revenue anywhere from 25 to 75%, which would be significant for us. The other thing that I would like to share with you is that it's really important that 50% of the payer mix is governmental payers. When we talk about payer mix, that's the breakdown of commercial insurance, Medicaid, Medicare, and self-pay. It's more beneficial for us if 50% or more is governmental, Medicaid and Medicare. The other thing that I take into consideration is the fact that we must hire a nurse practitioner, a physician assistant, or a nurse midwife. We call those mid-level providers. We have to have one of those in every rural health clinic 50% of the time the doors are open. That salary typically is anywhere between $90,000 and $110,000 annually, so it's a hefty salary. The other thing is we must file cost reports, which can be time-consuming and cumbersome. Let's look at some of the pros and cons of a transition to a rural health clinic. Pros: better reimbursement for us, increase in revenue. It would enlarge our organization. Right now we have 12 rural health clinics, and this would take us to 14. So ultimately expanding our outreach to the underserved, which is our mission anyway. Cons: increase in payroll. Holding the change of status or any delay in the change of ownership paperwork would hurt our revenue. Increase in costs, and we must complete cost reports. These pie charts are showing us their payer mix breakdown. I got this information from previous year's cost reports for both of these clinics. I know you probably can't see the numbers, but this Branson pie chart, the red indicates Medicare patients and the orange indicates Medicaid patients. So we are at our 50% mark easily. Forsyth, the red is at 51% in Medicare. We're fine there, and then you add in the 15% for Medicaid, and the payer mix is perfect for us. Even if we did a little marketing, we would be really healthy. I put together a little pro forma to show us potential expenses versus the increase in revenue. So assuming that we would see 22,000 patients annually, which is what they're currently doing, at a $75 per encounter reimbursement, which is very low. Our reimbursement is probably going to be $100, but I want to be a little bit conservative here. So looking at 22,000 encounters annually times $75, that would be revenue generated of $1.8 million. If you deduct some expenses from that, I've plugged in staff payroll and 2 physician payroll. I took actual numbers from cost reports on electricity, rent, cable. All of these numbers are actual numbers. The bottom line profit for us would be about $800,000 annually. So you know what my vote is. I will vote yes that we need to move forward with this project. But I'd love to hear what your feedback is and your thoughts on move forward, yes or no. Thank you for listening.